I'm the production manager here in the Brampton Centre. I'm responsible for overseeing the component production of the collections that we receive daily through blood donations. There are so many processes, so many people, so many moving parts. It can be rather daunting to think of it as a whole department. So the focus is really to go into smaller portions of those processes, smaller steps, making incremental improvements. As we've gone on this continuous improvement journey, we've now been able to get products to patients sooner, more efficiently, and the outcome for frontline staff is a great sense of pride. They're the people who are performing the tasks, are intimate with the equipment, the various processes, so they certainly have the best understanding and knowledge base to draw from. We have to still consider the level of quality and all of the safeguards that are paramount within the blood system.
Most of my job is to look after the transfusion service at St. Michael's Hospital. We are a level 1 trauma center, and we also do complex cardiovascular surgery. Those are the biggest consumers of blood in my hospital. What I'm there to do is to ensure that patients who need transfusions receive transfusions, but patients who do not need transfusions are not necessarily exposed to the risks of transfusion. If a patient is injured, there are unfortunately very few alternatives. In fact, what they need are the components, the red cells, the platelets, the plasma. But if a patient is going for a surgery that is planned, and we have plenty of time to optimize them before surgery, that's where the patient blood management comes in. In the past, we used to transfuse quite a lot of blood during surgery. We don't do that anymore. And we're finding that if we transfuse less blood, we actually have better outcomes. So the patients get out of hospital faster. We will also leave the precious blood resources for those who truly need it. We want gamma globulin products for our immunodeficient patients. We want sophisticated factor concentrates for our rare blood disorders patients. And as the need for red cells is waning, and the need for these specialized products is emerging, Canadian Blood Services is responding. We, as Canada, are extraordinarily heterogeneous and diverse country, and I think that's our strength. But it also makes it more challenging to supply specialized products. We have seen now great developments in the Canadian Blood Services laboratory services offerings. Ability to genotype for rare red blood cells, ability to test for rare antibodies. We are eternally grateful for that.
Staff certainly understand the impact that the tasks that they do have on the lives of Canadians. Going down the continuous improvement journey and standardizing the work and making their work easier gives them the comfort in knowing that the products that they're creating are of highest quality and will get to the patient as soon as possible.